next to come. Um, Hold on, I have to press continue, right? To record. Okay. So who am I? My pronouns are she, her, hers. I'm a proud Puerto Rican, born and raised in Puerto Rico. So you always gonna hear my accent, my thick accent. Um, Latina woman that I have worked with different communities throughout my life. I'm an older student. I'm 35 years old. So I'm older. What else can I say? This year, like from the past year and this year has been like hard for myself because I went through a lot. I was pregnant. I lost my baby during COVID, during Christmas time. It was really hard. Still, dealing with that. And I think pregnant women went through a lot and still going through a lot during this, the COVID experience. And I feel like my personally, what has helping me like through this situation is like my family, church, and like God, and like being positive in our social work program and my cohort. So that's a little bit about me.
Thanks, Jess.
I'll go. I think I was next after Jess, right? My name is Warren Graham, Assistant Dean of Field Education in the School of Social Welfare. My preferred pronouns are he, him, his. I am a proud Black man in the 6th generation of verified slave ancestry. My genealogy is actually one of my interests and passions over the last 20 years. I'm father, son, brother, uncle, crazy uncle. I'm the crazy uncle. The fun uncle, but the crazy uncle. Let's see, what else? I love to write. So I'm a writer and an avid motorcycle enthusiast.
Never knew that about you.
I saved it just for this occasion.
I was just going to say, you learn something new every day.
Yeah.
I guess I'll go. I'm Wendi Mathews. I am the Director of Student Accessibility Support Center. We like to say we're sassy. My preferred pronouns are she, her, and hers. How do I identify myself? I am a wife. I am a mother. I am also a crazy aunt. I'm a crazy daughter. I'm the fun one in the family. I am somebody who loves a chance to try new things, and my passion is photography, although I don't do it as much as I used to. And I think I would probably describe myself also as a lifelong learner. And I think that this is such a time right now where we're all constantly learning. And I love to take those opportunities to learn not only a little bit about myself, but also about other people as well. And I'm really happy to be here today.
Thanks, Wendi.
I can go. My name is Chris Tanaka. I use they, them, theirs pronouns, and I'm the Assistant Director for LGBTQ Services. And I guess, so some of my identities are, so I identify as queer, I identify as non-binary, and I have really intense ADHD, which shapes my life a lot as well. I am a parent. I'm divorced, so that actually had an interesting impact on my experience during COVID. I too ride motorcycles. Yeah, not very often because I am not a solo adventurer apparently, so I don't actually go riding much. Yeah, I think there's more, obviously, about all of us, but that's what's coming to mind at the moment.
Thank you, Chris.
Okay, so hello everybody. My name is Anthony Pantaleo, and I do have one piece of my identity, but I much prefer to conceal it because I do fear that people would treat me differently over it. So honestly, like that's pretty much like the only thing that's juicy. Other than that, I just like to think that I'm more of a generic type of person. Like I'm business and pre-med. I'm in a fraternity, Phi Delta Epsilon International Medical Fraternity. I'm a brother of a Rottweiler. She's like 4.5 months old. And I'm in a very stable nuclear family.
That's great, Anthony. Anthony, your name is coming up as Crippy. There's a few Crippies in here.
Oh, no.
Is that for everyone else too, or am I just seeing that?
It's on my screen.
Okay,
too.
okay. Well, thank you all so much for being here and for sharing a little sliver of your identity. Identity is very interesting because, you know, there's so many different pieces to us. We're never just one thing. We are such a culmination of so many different parts. But I wanted to just dip in a little bit to each of our identities before getting started, because I think it's important to speak to that a little bit. So tonight is going to really be centered on what the student experience has been during COVID-19, but not just as students, but also as faculty, staff, as advisors, as administrators, which is why I wanted to have a panel with, you know, a mix of wonderful people. And so when I'm asking these questions, I am thinking with students in mind, but I really do want to hear the experiences that, you know, the administrators, that the faculty, the staff, that you've all had in your, you know, everyday interactions with students. But if you also feel inclined to answer, you know, from your own perspective, like how you've experienced it, that's wonderful as well. So to get us started, what has your experience generally been during the pandemic in terms of mental health? How has it impacted your own mental health, and what have you observed in others, in your peers and your colleagues and your classmates?
Well, I could talk about it because you know, I'm very close to my cohort, so we always talk to each other. So I feel like these past years being I define it as a crazy roller coaster with ups, downs, here and there. Like one day we are so frustrated because we have so many things to do. We are tired of Zoom, like so many things going on. Sadness sometimes because family are passing away. Sickness, you know, it's like a crazy roller coaster. It's like to find just a word to define it for me is really hard. Right now, like from my experience, a lot of people's be depressed. Actually, older people from jobs, from the students, they're like their anxiety levels are really high. They're depressed. They know, like we as social workers, we all know, like we need you know, self-care, but it's hard to prioritize that in ourselves. And as students, that we are just like going. And even myself, I know that I have to prioritize my mental health, but it's hard to do it when you are like so focused on what you want and your future. It's really hard. Even like when the day that I lost my first son, I went to class. Nobody knew that I lost my son and I was in class. So, you know, like people like us that are very focused in like our standards or in school, like we just keep going. So like that's why I say like mental health roller coaster.
Thanks for sharing that, Jess.
I would say for myself, this has been very interesting because it allowed me to kind of stop time a little bit. I'm somebody who was always on the go. I was taking somebody to an activity or doing something at work, and I never took time out for myself. So this allowed me actually to refocus myself and focus on what my coping skills could be for this time. So I ended up actually taking on like a new healthcare regimen, and I started working out at home pretty regularly. And that kind of inspired my husband, who was somebody who did not take care of himself. So we ended up bonding together and finding, I guess, like a neutral ground together of something we were experiencing together. And we ended up just working out. He lost 60 pounds. It was amazing for him. I did not lose 60 pounds, but he did. But but I think it allowed me just to take some time to self-reflect. And when things started opening up again, I actually found myself to be so much more of an introvert, which is not who I am. I'm more of an extrovert and I like to go out and do things, but I have found myself scared to actually go out and do things. And so now my husband, who's home all the time because he's working from home, is like, let's go out, let's do things. And I'm on the other end going, no, but I really just want to stay home today. So I'm trying to, I guess, learn how to acclimate back into life, or whatever life is going to be for us. So I think, again, I'm just trying to use whatever I have to kind of get through that.
Thanks for that, Wendi.
One of the things that I've seen is this shift, and people not having the same avenues that they used to cope with stress. And so it's forcing people to be creative, to really think outside the box. Lots of anxiety, lots of depression. But one of the things I found is, as we continue to, I feel like I was taught how to compartmentalize, as a professional, but there are blurred boundaries between, who you are now in this pandemic, working from home. I'm a student as well, so I'm working from home. I'm a student from home. I'm a parent at home. Like everything centers around the house. So in any given moment, I'm not quite sure who I'm supposed to be or what role I'm supposed to fill. And I've seen that in the students I work with in field education. I've seen that with the field instructors who supervise them. It's been pretty much an experience across the board, this really tectonic shift, as everyone tries to kind of acclimate to this, what can be a once in a lifetime event.
Yeah, absolutely.
I think on my end, so my personal experience was kind of interesting because I guess similar to Wendi, I channeled my inner introvert, which I didn't know was super, there in my life. And as it turned out, the pandemic and like quarantine was a time where I was actually like thriving. I was like, I don't have to talk to anybody. I don't have to go anywhere. Like, this is fantastic. And I think on the other, so yes, I definitely have seen a lot of folks struggling with mental health, particularly, with the LGBTQ communities that I work with. I see a lot of folks who are really thrust back into their homes with family that may or may not be super affirming or even know how they identify. And so, coming from our campus, they're allowed to explore their identity and sort of come out of their shell a little bit, and then, having to go back home and either, being too afraid to say anything to their family, or their family knows and it's not like a nice experience for them. So I validate that. I see that absolutely. I also think one of the little spoken about things is the folks who have like social anxiety and are like super introverted are really doing kind of well right now. And it's been exciting and a relief for me knowing that some of the folks that I may have had to worry about a little sometimes, in general, in this pandemic, those aren't the folks that are really having a hard time. It's the folks who are out and about and doing things that are now like, oh, what is my life now? I don't know, I don't know what to do. Like, I'm at home. I don't have my circles of people. And, because of the nature of my work and the community that I work with, a lot of our LGBTQ students stayed on campus. And so, we ended up going back phase one. And by we, I mean me, because I'm the only staff person over there. So, we're running the center, and we've been back since the beginning of this academic year. And that's been an interesting experience too, like seeing everybody else sitting at their house on calls, and I'm in my office, which is, it's an interesting position to be in, and reflecting on that is definitely been hard, and also eye-opening in a lot of ways. So
Thanks for sharing that, Chris.
Okay, so my experience, so at first it was very, very rough, the transition into COVID-19. So I just was forced to pack up all my bags and all of that stuff from college, go on home, and, you know, I wasn't very, very connected to anyone through my social media at that point. Like group chats for my classes, what are those? I wasn't really into that back then. And all I really had was like a few phone numbers, and yeah, that's pretty much it. And the class environment in this stage was just like not very developed. People weren't really maximizing back during that time. And then, to make things even worse, my grandfather passed away during the summer. And really, to tack onto that, like that feeling of extreme loneliness, losing a family member that I idolized, someone who I saw inside of me, it's really rough. But, sometimes during these really, really rough times, that's when you can really discover your inner strength. I just remember I went to the fall semester and I cried after the first week. I'm being completely honest. It was so much work. Like I'm doing 2 lab courses, organic chemistry, and 17. It's so much. And after some time, what I found was just by attaching myself to my work, like really absorbing myself in it and enjoying it, like trying to learn from it, that's one of the best ways to definitely get yourself going. And I also found that I was able to solidify stronger connections between me and my classmates on GroupMe. So I joined like the organic chemistry group chat. There's like 800 people in that. And I was always really active there, helping people and just being able to cultivate this community where everyone's helping each other with the work. It's definitely mutually beneficial. Like it helps boost up everyone's spirits. And so overall, I'd say like, though it started out extremely rough for me, like as it stands right now, I would say that my mental health is extremely firm.
That's great, Anthony. I think what I'm hearing from all of you too is like, paying particular attention to resiliency. Humans are so resilient. And I think that this past year has really shined a light on that. So thank you all for sharing that. So thinking about like how we've handled the past year, what sticks out to you, to each of you as, a coping strategy that you've used to prioritize your mental well-being? Or if you don't want to speak on yourself, maybe in what you've noticed in the students that you're working with, what's something that stands out to you?
So for myself, driving, I like driving. I like traveling. So driving, I could drive for hours, and especially during COVID, nobody was out. So I used to drive back and forth everywhere. Now we have more traffic. And something else that I feel like it helps me even now, like that I do, is like when I feel like that I cannot anymore. Okay, this day, no Zooms, no calls, no one, just me. Go to the salon, do my hair, do my nails, just me, and no computer. I have to put it away because it gets frustrating sometimes, because some weeks we are like the whole day in the computer, and physically it gets we get sick. So when I feel it, I say no, it's time to stop, debrief, and take care of myself.
One of the things I like about that, Jess, is being able to stop, right? I found that over the course of my career, like I've been so focused on moving, and doing. One of the ways that I've found to cope is just to stop. Whether it's just mindfulness and really being present in the moment, but it's really forced me to look at what's really important. I don't know about any of you, but I know I used to fill my time with a whole bunch of crap that now when I look back, I'm like, that stuff really isn't important. If I only have but so much mental energy or emotional energy to deal with something, I'm crossing things off the list. It's not this, it's not this, it's not this. And that's been really extremely helpful, helping me to refocus, and look at the bigger picture. And that's also helped my photography, like Wendi. It's helped my art, it's helped my writing. And when weather permits, I hop on the motorcycle and I try to find ways to marry all of those, interests, because all of them contribute to, my well-being.
I think for myself, echoing really, what Jess said and Warren, I found myself with my phone and it was always by my side and you could be talking to me and I'd be on my phone, I'd be emailing work, I'd be texting somebody. And I agree, this made me just stop. And now we actually have a box in our house where like all of our electronic devices go and we all put it there, everybody in the family, my kids, myself, my husband, and we say, okay, it's just us time. And I don't think we would have done that if our world just kept going the way we were doing it. So now like I make sure like I make sure I laugh at things, right? Like I think that at some point I lost the ability to laugh. Like I was so much in my head. And now I sit there and I'm like, oh my God, that was so funny. And I just take the moments just to enjoy the little things. And I think sometimes we forget about that. And this caused me to basically just stop, refocus, and enjoy the little things again in life.
I think that's such a awesome idea of just like putting down all the electronics. That's something that I started to do more as things were starting to open up. When things really shut down, I was on the electronics all the time because that was the only way that I could see my kids. I was only able to FaceTime them. But I was also working from home and they were being homeschooled. I'm lucky that my ex is a certified teacher. So she's actually like homeschooling, not just doing virtual school. So their schedules are free. And so they text me all the time and they'll call me in the middle of the day. And that was my way. And so, I now when I get to see them in person, like I put everything away. But I think the technology actually made it a little bit easier. I have a lot of friends that moved away from here, and it's like, oh, I never get to see them. I only like text them every once in a while, and then like Zoom happened, and I was like, oh shoot, I can hang out with my friends on Zoom, and so I feel that I'm much closer to people who are much further away now. And so that I think connecting with people and really, I know a lot of folks, I'm seeing on here, a lot of folks have cameras off and mics muted and all of that. And I think that it gets hard sometimes because, a large portion of our communication as humans is nonverbal. It's nodding, it's the laughter. We don't hear laughter anymore because everybody's muted, right? And I think that has a huge impact on mental health. And so part of the things that I try to do in the spaces that I'm in, even on Zoom, or particularly on Zoom, is really ask people like, I know you might not be looking like a model right now. And I know that like, there may be some background noise, but like, put it all on. Because we miss you, right? I want to hear people laughing. Like that's something I think that's contributing to the isolation sometimes. And so that is a coping strategy that I've been trying to share with folks. As somebody who works with LGBTQ communities, a lot of what we do is help people be seen. And sometimes that's more literal than figurative. when we're in Zoom.
Okay, so one coping strategy that I have tried to employ during this time is giving myself something to look forward to. So, for example, hold on, can you please give me a moment? I'm sorry. Okay, now to get back on track. So, last semester when I was in organic chemistry, I just figured that it was so much work and, amidst all the other crap that I was taking. So, one thing that I decided to do was fire up movie nights after every single exam. I thought that it would be a great way to cultivate community within all of the students. I get people to show up, watch the movie, and use the chat feature because, kind of like a real movie, you don't want people actually talking. Like, that's not going to change. So I did find that after some time, I was able to get a following. So I was able to start up a committee. People would vote on movies, and we had 7 movies that we got to watch. Actually, 8 last semester, and we had a marathon once all the finals were over. So just giving myself something to look forward to, and for all the other students, like that was definitely something that was a positive impact on my mental health. Like just saying like, all right, so I've got a movie coming up, I can't wait. Something small like that can just bring so much joy to someone.
Yeah, absolutely. Absolutely. I love that community building. I'm all about that. And Chris, I love that comment about like having yourself muted and not having the camera on, and how that really does take away a bit of like the human element. And I haven't thought about that not hearing laughter and only getting to see it and how that's impacted our mental health. That was a great point. Thank you all for sharing. So over the past year, I think towards the beginning, and this is coming from my own experience too, I think there was like an air of a lot of compassion, a lot of flexibility, especially in the academic setting. But as time has kind of gone on, I think that there has been a shift back into like, all right, we need to get back to order, we need to get things going. And so I was wondering how each of you have felt over the past year in terms of pressure. Have you felt pressure to stay productive over the past year? And how was it towards the beginning of COVID versus now? And I guess if you want to touch on like, how have you handled that pressure?
Myself, I'm bad at that because I feel the pressure and I put more pressure on myself. And now what I'm doing is like thinking, if I'm in because what happened is my internship, it's online classes, and then like I only needed 2 classes this semester. I'm doing all of them because I said like I'm paying for it. Let's take 2 more electives because they're gonna help me somewhere. I'm gonna learn. And then one is proposal writing, and the other one is on campaign school. So they go together, And on top of that, I'm TA in a class with Professor Akoni, Dr. Akoni. So I'm TA in the human class with her. And my internship. So, and family, and driving, and going. I'm from Long Island, but I'm living in Newark. Right now I'm on Long Island. So I'm all driving from Newark to Long Island, Newark to Long Island. All my staff doctors are on Long Island. So I have to divide my time in a healthy way. And it's hard. And sometimes I think like what I'm doing is like, when I'm writing my at time is I'm thinking, so like, if I were to go to work, there's a lot of time that you spend connecting with your coworkers. That is not happening right now. There's a lot of time that some days that, you go out to eat, you do this with the coworkers. It's not happening right now. So in that time, count towards your work. So I try to figure it out. And then my meetings and everything is so spread out. Like we have things going on even on Saturdays, during the week. So what I do is like, when I do like kind of my hours, I put them all together. Like, let's say I work the whole week. No, I keep it on Wednesday, Thursday, and Friday, because if I don't know how to explain it in better words, but it's because we have so much. And I feel like now the new semester, like even though it's virtual, coursework and all the work still, like, we have no COVID or anything else. It's a lot of work that we have right now. And assignment is, I feel like all, like, from the students' perspective and the students that I've been talking to, they're very overwhelmed. They have a lot of things going on. They have family issues, and they overwhelmed because they cannot connect with the other students that they were used to get help from. Like, when they're doing like research, it's hard because sometimes the internet is not working. Sometimes, like myself, I have a lot of family, so I have to keep yelling at them, stay away from me, I'm doing this, like, it's my time. And then telling them to understand that when I'm in the computer, it's because I'm working, and they need to respect that. And for them, no, you're home, working. And it's really hard to separate those two, like work, school, and like home, when you're actually working from home. So it's a constant, for myself, it's a constant telling, remember, this time I'm doing this, you have your time, I need this time. So it's a constant telling and trying to separate it, and thinking sometimes, like, even if I'm not like working in something, I feel like, oh, well, I might be chatting with someone at the office, if I was in the office and learning from them. So I'm like making up that time in different ways.
I think the productivity piece is really interesting, and it's showing up in like really weird ways. So, all of the meetings are virtual now. And so everyone's like, this is great. It's super great. Except now people know that it only takes you 3 seconds to get from one meeting to another. And so all of a sudden your schedule is back to back to back to back. And you're like, I just need to pee for a second. Like, hang on. And so I think our schedules are now super packed. And I think, in the very beginning, when everyone was sent home, or actually before everyone was sent home, there was like a weird in between phase where some people were still on campus, but like there were no students here. And a lot of the energy was spent being like, I shouldn't be here. I shouldn't be here. And sort of the self-advocacy on that end. And then when everyone did, leave campus, it was very much like, tell me what you're doing every minute of the day, which is not what would happen when people were at work, which added a whole other level of work, right? Because like writing down every little thing that you do for every minute of the day is a lot of work on top of the actual doing the things. For me personally, as somebody with ADHD, it was fun for me because it was like, ooh, this is something new, and I get to like work on a new project and try different things. And I found that I was very, very productive when I was working from home. And as I've come back, I'm like not super like as focused because it went back to like the flow. But yeah, so it's like a different we didn't go back, right? We didn't go back to that same flow, but it feels similar to what it was before, for me at least, because I have to go like to campus every day. But it's weird, I just sit on Zoom all day. So yeah, the productivity piece, because our days are so densely packed now, because everything is there's no travel time built in anymore. I've been able to, for the first time in my life, put up like a hard work boundary. Like when I'm done working, I'm done working. And it's gotten to the point where like I'll get home and somebody be like, how was your day? I'm like, I don't remember, I left. Like that's a topic for tomorrow. Because it's just, in order to create that separation, particularly if you're working from home, you have to be able to set it aside and put it away, or else you just work all the time.
For myself, I've seen or felt a lot of pressure being productive. So in field education, I'm coordinating the efforts for almost 600 students who are in internships and placements. And they say field is the signature pedagogy of social work education, right? That just means it's supposed to be really important. But this pandemic has really affected student learning because it's affected the agencies that this learning is taking place in. So as everyone is struggling, emotionally, trying to acclimate to this new space we find ourselves in, I know I do feel a lot of pressure trying to fix it, right? To fix all the problems that students are having with internship. If it's remote and you didn't want remote, how can I fix it? And it's a daunting task. So unlike any other year where the challenges with field education are maybe connecting a student to their ideal opportunity, but they're pretty much getting what they want, out of the deal. And that's not the case now. And all offices of field education in every school of social work is struggling with the exact same thing. So not only is there pressure to be productive, but there's also no one to lean on. Like in past years, we can call each other and commiserate, but there's no one to offer feedback on, well, how did you fix it? We're all looking at each other like, I don't know. How do you fix it? I don't know. So the only thing that's helped is, for me, taking the advice I give some of my clients, my private practice, that it's okay to be human, right? It's okay not to be perfect. It's okay to drop a few balls sometimes. It's okay, that's your right, right? And I don't have to be the one to have to fix everything. So while there is intense pressure to be productive, I'm starting to forgive myself when I am not.
I would just piggyback off of that too, with what Warren's saying, is that I feel like I'm a fixer, right? So, when all of this happened, I was trying to figure out very quickly how, as my dog joins us, I apologize. How do I make sure that we stay connected to our students, right? So, one of the things that sometimes an inaccessible world, how do we make sure that we're still able to connect with others and develop programming opportunities so that we are feeling like we're connected? And I felt a lot of pressure to be able to do that. Along with that, I decided to take on a social work intern this year. And it was, it's my first social work intern. And I felt pressure because I want to make sure that person has a really good experience in this type of environment, because we are, I normally would be seeing this person and they'd be doing it, with me. And now, having them do it remotely is, definitely interesting, but putting pressure on myself, to make sure that's a good experience. And I think what Warren just said is something that I tell myself every day, that it's okay if we're not perfect, right? Sometimes the perfection in us all is the imperfection in us all. And that's what I try to tell myself every single day.
I'm going to jump in off of that too. Certainly I think being kind to ourselves, and the parallel process that I feel working with, I'm a field supervisor, and my interns, I am so grateful to have them at this time, because I'm telling you, like, the technology piece, I certainly have struggled with, and really am so grateful for them to bring some new, fresh ideas to the table, because with the stress, you're kind of like out of ideas. And so, I thank you guys for very wonderful, competent, and exciting, vivacious interns that I have. And, listen, we're all going to get through this. We're all going to be okay. It's been tough. Somebody said something about overscheduling all the time. I learned that it's okay to take a break through all this, and learned about really practicing the self-care we try to instill in the students that we see. So, let's all take care of each other. All right.
All right. So now, as far as staying productive over this, my dog's barking. I hope you don't hear that. As far as staying productive goes, like, it depends upon how you define the word productive. So if it's like are you getting work done more effectively? I would have to say no, because this online format is not as effective for me personally. So for me, what was working was the traditional structure. So I would go to class every day in like Javits, Harriman Hall, something like that. And I would be there in person. I would have every desire to be at full attention. So my phone is in my pocket. I'm looking straight at the smartboard or the professor or both, and I'm actively taking notes. But the way that we're doing things now is not nearly the same. When we have a lot more accessibility to technology during these times. And for me, when you have to type on the computer all of your notes, I mean, like, yeah, it's great for note keeping purposes, like, and it's more portable, but besides that, it's just like not as effective when it's like, wait, I missed that. And you're just too busy focusing on typing on the computer rather than like, I just like to look at the smartboard and write notes at the same time. It's not nearly as good. My smartphone right next to me, that's also distracting. I'm looking at GroupMe all the time. I'm not gonna lie. So all in all, like, productivity on that note, it has not been as productive. However, in terms of just dedicating more time to my schoolwork, I would strongly agree, because there were some, downtime. There was some downtime when I was at Stony Brook University in person. So like walking to classes, and it's the winter time, so I'm not really exercising, but I would go to the gym for like an hour several days per week. So I'm losing some of those liberties, but just because this is kind of like the life I'm living right now with my schoolwork at the very forefront, although really it's my mental health, like, I wouldn't continue for like that bad. What was I saying? Oh yeah. So just, this is what I do, is what I'm essentially saying. This is essentially what I do, but I'm just not doing it as effectively, but I'm still managing and I'm pretty happy.
That's great. That's great. Chris, did you already share? Okay, I lost track. All right. So the next few questions that I'm going to ask, and I'm realizing that it's 10 to 8 already, and I still have more than half of the questions I wanted to ask left, which I feel like always happens. But there are a few that I really would like to get to, and these don't have to be answered by everybody on the panel. Just if one or two of you would like to respond to them, that would be wonderful. So the first question is, how do you think that gender has impacted the way that folks are experiencing the pandemic, in terms of like how they're socializing, and how that's been altered over the past year?
So the only point that I'm going to touch is like when I was pregnant, that impacted really, because I was afraid to go anywhere. I was really afraid of like, I was looking for jobs, but then if they said that the job was in person, I said, no, I don't want it, because I was afraid. Even when I went to the doctor visits, they were like, they didn't let nobody in for sonograms. Like I said, no, can I let my partner come with me? No, nobody, none of your family, just yourself. And they just take your name, go to your car, and we'll call you when we're ready. So that part was very like scary as a woman and as a pregnant mom. So it was scary. And then like trying to take care of yourself and trying to stay away from other people because you don't know where people have been. So in that sense, it was scary for me.
I think something that came up that was a little bit unexpected was all of the rules that had been loosened up in the pandemic. There were certain rules that were not. So like, you can have a takeout alcoholic beverage, in a little plastic cup, as long as there's not a straw in it, right? So we could do takeout alcohol, but you can't take out things like your testosterone, right? So there were folks who had underlying health conditions that put them at high risk, who are also on what are considered controlled substances, right? They're hormones, which is something that is vital to their mental health. It's vital to their physical health. And only you can pick up your prescriptions. And so there are a few folks who were not able to continue with their necessary hormone treatment throughout the pandemic because it was unsafe for them to go and pick it up from the pharmacy, which is where people go when they're sick, right? So, that was something that I don't think a lot of people realized was happening. And there wasn't really a lot of ways around it for folks who had, co-occurring conditions.
Wow, yeah. One more comment on how different genders may have experienced COVID. No? Okay, all right. I'm going to move on to the next question then. So how do you think that different races and ethnicities have experienced the pandemic? And when you're speaking to this question, I would like if you kind of consider your own identity and then those of your classmates, colleagues, students, etc.
Well, one of the things I found interesting is communities of color have long enjoyed, kind of banding together and working through kind of like this thread of oppressive practices and experiences that, connect all BIPOC communities. So communal living, being able to rely on your neighbors has long been an insulator, right, against poverty. And when we think about all the social determinants of health that contribute to negative outcomes for people of color. And in my private practice, one of the things I'm seeing is people are missing that. So it's not just the isolation that the pandemic is bringing, across the board, but it's also the, going next door to borrow a cup of sugar because you're baking and, you can, talk about what your latest oppressive experience has been. That lack of support, really hasn't been there. So it's not only the isolation from one another, but also people are being isolated, people of color being isolated from the experience, or the common experience that everyone is having, without having the ability to come together and being in the same space to process some of that. So that's one of the things that I've seen.
Anyone else like to respond on that one?
I can add to Warren. I agree with him. Many Spanish population, we all, especially for me, we are a church family, so that was crazy trying to get the church running, and we are a community, family, even though we are from different Spanish country. We have in the church, we have Portuguese, Dominican, a lot of Ecuadorians, different Latino community. But when the COVID happened, it made them my dad's phone was going crazy every single day because they couldn't get together, they couldn't communicate. There was a lot of things that they were missing, that service, that seeing each other, hugging each other. Now we started again, but a lot of people is not coming again to church because they feel afraid of something's gonna happen, the lack of knowledge. But what we have done is trying to provide services at church. We call the family, oh, you need food, you need masks, you need hand sanitizer, we have this at church. So trying to help them, because this is a really hard process for the minorities communities, I feel.
I just wanted to also add too, because, when Warren was talking, it made me think of something, a lot of the current events that have happened while, COVID was going on, in a way, we were able to connect divisionally. So, underneath, the division that I'm currently under, which is student affairs, with a whole bunch of colleagues that I don't think we necessarily would have been able to do if it was pre-pandemic, and we had a lot of discussions regarding race, inequality, and our own personal biases. And I don't think that conversation would have happened if we weren't in this format. So in a way, it allowed us to have some dialogue. And I got to really experience and hear from my colleagues, which, I mean, it brought many of us to tears just sometimes on the phone, you know, on these Zoom meetings, just to hear about what was going on in people's lives. So that was just something that when Warren was talking, it just clicked.
Yeah, just to sort of add to that, there are a lot of students that were impacted by, you know, events that weren't necessarily specific to the pandemic, but happened during the quarantine. And there, you know, a lot of it was really scary for folks. I mean, we're seeing all of the, you know, killings of Black people by police officers, right? We're seeing attacks on Asian people, because I think that's a little bit more specific to the pandemic, right? Because of all of the rhetoric around sort of the origins of COVID-19, and, you know, being able to support students. I just, again, toward the very beginning, when students were told, like, go home, there were definitely students that came to me and they were like, Chris, I'm afraid to travel because I don't want anybody to, like, look at me and think that this is my fault or I'm dangerous and, you know, as folks who are trying to support communities, like, there's, you know, I'm not going to be like, oh, that'll never happen. It'll be like, I can't guarantee that. All I can say is, like, you know, here are resources in case something does happen. And, like, here are some tips on how to, you know, travel in a safer kind of way. But, you know, we can't guarantee people's safety at this point.
Yeah, those are great points. So kind of going along with that, in terms of, like, sexual orientation, do you think that the LGBTQ plus community has experienced mental health issues in the past year that maybe the heterosexual population has not? And I guess, like, in folks who identify as being a part of that community or working with those communities, you know, what has the experience generally been?
There's a lot of homelessness. There are a lot of folks who are couch surfing. There are a lot of folks who whose financial aid status has shifted because of the pandemic and can no longer afford to stay on campus. There are a lot of folks who are in not the healthiest situations at home with family. And, you know, a lot of the resources are online, and a lot of the access to online venues is from their computer at home. And so even when folks are coming and, like, meeting with me, there are moments where, you know, you can see the door behind them open and they completely shut off. And I'm like, I can't hide. You know, it's hard because even the help seeking that folks are doing is not necessarily safe in any given moment. And there's only so much access people have to, like, cellular data or, like, Wi-Fi if they leave their house, to be able to, like, go on a walk and you know, have a talk with a counselor or a therapist or something. So folks have really been struggling because, you know, where a lot of folks may find home to be, you know, a place where you can feel most you know, for a lot of LGBTQ folks, it's not the place where people can feel the most of who they are.
I was going to comment, you know, a lot of my students whose parents have not yet accepted them for who they are, um, you know, have like sent me private messages and said, you know, when we have group today, make sure that you refer to my, you know, my real name and like the name assigned to me, not the name that I've asked you to call me, and you know, reference me by my, you know, pronouns that are from birth rather than, and which I know makes them feel so uncomfortable, and it doesn't really allow for a good therapeutic moment because so I just kind of, I don't reference anybody by anything, no names, just how you doing? What's up, babe? You know, like I try to excuse any level of pronouns or name calling or anything like that, just to kind of let that not be that sting that they feel, you know, while in counseling.
Yeah. You know, I think this is really highlighting how marginalized groups have really been impacted in a different way during COVID, and has absolutely impacted mental health in many different ways. And kind of going along that same vein, you know, how have students with disabilities been impacted by the pandemic this past year? And you know, going along with that, I want us to think about like, what is the chance that virtual mental health resources will continue to be offered at Stony Brook? Because I do think in some ways, it definitely has made services more accessible, and will be a convenience for certain students in years to come. So I guess it's kind of like a two-part question.
So I'll hop on as far as, you know, working with students with disabilities. So in some ways, this has taken down barriers, but in some ways, it's actually increased barriers for my students. So, for example, you know, students that, you know, wouldn't able to be in the classroom who maybe suffer from PTSD, and sometimes being in the class can be very triggering for them, or hearing a noise in the classroom, there might be sensory issues. Being in a Zoom format has sometimes worked out in a better way. They can take themselves off camera, they feel more comfortable. But in some ways, it increases, you know, the barriers. You know, for example, we're all used to talking with masks, but for my students that have, you know, hearing impairment, or some of my neurodiverse students who really need to see facial expressions, when you're wearing a mask, you know, that's something that they either can't read lips or can't pick up on your facial expressions. So, you know, I know one of the things like I was so passionate about when this hit was those students and figuring out, so what can we do, you know, to assist those students? And we ordered a bunch of clear masks for the campus community to say, you know, we hear you, we understand, and, you know, we want to support you. You know, and even just, you know, our students are potentially at higher risk. A lot of my students that have medical disabilities, and they can't be on campus because it's a risk to their health. And, you know, but if they're online, I have some students that maybe suffer from seizure disorders, and looking at a screen too long can actually trigger that. So, you know, in some ways, it's increased accessibility, and some ways, you know, it's decreased it. And I think this has caused my department especially to figure out how to be creative. You know, how can we provide, you know, a similar experience with our students and make sure we're providing access every single time? And sometimes I forget, right? We're human, and a lifelong learner, right? So I'm constantly educating, you know, my peers on like, how do we make something accessible? You know, how can we do it so everyone can take part in it? So I think that that's probably where, you know, I would stand, is there's some good, there's some bad, and then there's kind of in the middle. But just trying, you know, next time you're, you know, with somebody, you don't know where they're coming from, and, you know, trying to design whatever you're doing in a universal format so that everybody can take part in it.
Thank you, Wendi. So I just want to ask one final question to all of the panelists. And then we're going to be moving forward and talking about some resources and closing up the night with a mindful moment. I do recognize that we are over my very optimistic hour, but I'm hoping that by 8:30, the absolute latest, we will be done. But this is an important conversation, and I really don't want to rush it. So what are some ways, like thinking back on this whole conversation, what do you each think are some ways that higher education has helped and or hindered the mental health of students, of faculty, of staff, of administrators, in, you know, kind of think of it on like a very basic level. And I'd love to hear from all of you on this one.
Well, I could start with the use of technology. Now we have this option. So I think that's a great option that like now, like going on, like let's say when we get back to school, schools can provide both options to students, like to have options online, and so because it's possible. So that's on the positive side. On the negative side, I feel like when it comes to schoolwork and amounts of reading and like the time that you spend like on the computer, because now like my thinking is like we are like let's say 2 hours in class, but still we have for like homework and everything else we have to be on the computer. So it's not like we're taking time off the computer. So I don't know if people are thinking about that, but I think that is impacting students, and I'm gonna leave it there.
I'd love to add to that, Jess, because I think one of the ways, you know, like you said, like higher education has helped to address the mental health, you know, needs of staff and students by, let's say, doing hybrid learning, by having total remote courses, by you know, having remote assignments in field where you don't have to go in and work with a specific population in an agency. But I think one of the ways in which higher education has kind of failed is, and what you started to suggest, that, you know, when we look at the time spent on Zoom, you know, a 2-hour class in person is not the same thing as 2 hours on Zoom. So there needs to be a way to really look at, you know, how is it comparable, right? And I'm not saying you have to create, you know, some super complex formula where 2 hours on Zoom is, you know, equatable to an hour and a half, or 2 hours in person, you know, is an hour and a half on Zoom, but at least have the conversation, you know, because, you know, being on Zoom all day in classes, then being on Zoom for internships, and then being on Zoom so that you can socialize with your peers and family who you know you don't have an opportunity to connect with, and I feel it's unreasonable. So, you know, I think the schools can do and should do a better job, at least looking at that, looking at the quality of the assignments to say, is there a way that I can shorten class and allow students to work independently, where maybe you can call each other so you're not sitting in front of a computer screen. So that's my 2 cents.
So I guess I'll go. So mine's a double-edged sword. So in some ways, I guess my frustration, I will say, has been content that's not accessible. And I think that for me has been a struggle, right? I think that that's something that I'm constantly advocating for my students every day. And I think for me, that's been in some, not in all areas, but in some places that we, you know, that we need to improve on. But then on the other hand of it all, I've seen faculty that have risen to the occasion and would spend about 8 hours just putting in, you know, captions into videos to making sure that it's accessible for students. So I've seen some faculty that have never used technology that's calling us up being like, okay, I'll spend a whole day with you on a Saturday. Let's figure out how to make this accessible. So I think it's a little bit of, it's kind of like a mixed bag for me. And I think that for me has been a struggle, but also for my students that do have mental health. And that's something that they're struggling with. I think that the stigma behind that, I think that that is something that is real. And, you know, in some ways, I feel like there's sometimes an increased stigma when it is in a Zoom format. I think people can hide sometimes when we're more in a classroom kind of setting, but when you're sometimes in a Zoom and everybody's present, I think sometimes it's harder to do that. And I think that there are stronger thoughts and biases that people have that sometimes come out in these type of formats.
I think, you know, just to add to all of what everyone's saying already, I think some of the things that have been really great is that this format actually works better for some people. You know, I taught a 101 course last semester, and I had more engagement in that class in any other 101 that I've taught. And I think it was not verbal, it was not video, but people were chatting away in the chat. And that is something that they would never have the opportunity to do sitting in a classroom. And so, like, yes, I missed seeing people's faces, and yes, I missed the laughter. But it was really cool and amazing actually to hear just people chatting about like video games, like maybe a little off topic, but the idea behind that class in particular is for folks to get connected. And so like have a conversation in the chat about like your favorite anime show, that go for it. But I also think the different, I lost my train of thought. I think the different ways that it hasn't been super awesome, you know, with the addition of more asynchronous classes, I think there have been, yeah, I have a hard time seeing the parallel between like discussion board posts and in-class conversations. Because discussion board posts, you're putting things in text and everything needs to be cited. And so it's not just a conversation now, it's like a mini research paper every time you have to post. You know, if I'm sitting in a class, I'm like, I think I read something somewhere about blah, 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 right? And when you're on a computer and you have access to finding all of the citations, that you're expected to do that. And so it sort of hinders the amount of just like off the top of the head things that like I heard this or I may have read this somewhere conversation, and it becomes little mini research papers every time there's a discussion post. The other piece is you know the screen time. A lot of people, like, it's happening in the chat, people are talking about it, there's Zoom fatigue. And yeah, people are tired of being on Zoom, and then they're just tired because being on electronics makes it difficult for you to sleep, right? The light from it makes your body think that it's morning and not time to go to sleep. And like sleep is such an important thing. You know, all of the things in your body and in your brain regenerates when you sleep, and people are not getting an opportunity to sleep well because they're on a computer all day. So, you know, there's a lot, you know, it's back and forth. As Wendi said, it's a double-edged sword.
All right, I know that we're running over, but like I'm obligated to go. So I would say that faculty-wise, so there are some faculty that have gone above and beyond for their students. Like they're making the exams a little bit easier, which I kind of like dislike on one hand, but like I get an A, other hand, and they're like more receptive to like requests and understanding of people's circumstances, like perhaps in the instance of technology, those kinds of things, because obviously some people have different extenuating circumstances like lesser access and stuff like that. But it's not something that I personally understand like from experience, but I just recognize that's a possibility. And then there are just professors who just seem to care a little bit less. Like they'll just, with asynchronous courses, they'll just be like, here's a bunch of slides, listen to them and come back to me. Something like that. It's not really engaging. They're just, it's very, what's the word? Laissez-faire, like very, very, very hands-off, minimal effort from their part. And it's not really benefiting the students that much. It's just like, if you have any questions, come to office hours. But this asynchronous learning style to me is extremely ineffective. This is just my personal anecdote, of course, but I just really, like I said earlier, I just think it's much better if you're in the present, like you're there in person and you're actively engaged. And just allowing this type of setting allows for the professors to slack themselves. And another thing that I was thinking was actually about the spring break that we lost. So I think that it's not very good to take away our spring break because that could have been our so-called mental health week. Instead, they insert our spring break into the week of January and called it a spring break for whatever reason. I mean, come on, that's winter break. And I don't think it's doing the students that much justice. Like I'm in all my classes and people are always complaining about, and I would say within just reason, because with that 1 week off, it gives us a great opportunity to perhaps like get done a small amount of work that's due in that coming week and generally just decompress, because without it, really, you are much more susceptible to burnout, because we don't want to do all of this work, like especially if you're doing 21 credits, they feel horrible for you. You don't want to do all this work for 14 straight weeks because it can get extremely overwhelming and you're just going to wonder when it's going to end. And you'll be saying to yourself, not soon enough. So that's pretty much it, I think.
What a way to end, Anthony. But absolutely, I totally agree. I think that, it was an interesting choice that the university made to take away spring break. I think from a public health standpoint, I get it, I understand. But I think from a mental health standpoint, it's concerning. And I know certain programs, like I know the School of Social Welfare definitely pushed for like a staycation week, and my classes are not happening, I think week 9 or 10. I can't wait, it can't come soon enough. But there are many other programs within the school that it's not the same. And I do think that is absolutely worth mentioning and is really important. So I wanted to thank all of you for participating tonight. We are going to do a quick overview of some resources, but I did want to thank each and every one of our wonderful panel speakers tonight for taking part in the conversation and being present with us here on a Friday night after, I'm sure, a very long Zoom week on yet another Zoom. So as we're all complaining about Zoom, sitting on Zoom. So thank all of you so much for taking the time to be here tonight. It is much appreciated. And this was such an enriching conversation, and I'm seeing the chat blowing up on the side. I can't even keep up. So I'm really happy, and I think you definitely brought up some really important points. So we're going to change gears just a little bit. I would love to introduce to you our wonderful chill peer educator. She's a leader. She's a chill leader. Yes, she's a chill leader. And she is a wonderful asset to our mental health peer educators this semester and past semesters. So Gina Ferrara, she is going to present some mental health resources that we have here on campus. So I'm going to pull up a short PowerPoint she put together for us today. And we're just going to go through some resources.
Hi, good. Can everybody hear me? Okay, great. So hi again, my name is Gina Ferrara. I'm a chill mental health peer educator, and I basically help students, I help my peers get to the resources that they need, whether it's doing a workshop or whether it's doing some form of outreach. And I'm also kind of like having a little leadership role, helping any of my chill peer interns in the class as well if they need any help. And we're doing like a lot of really exciting things in our internship. So what we have here on the screen right now is a roadmap of what we like to call it, of our resources. So CAPS is our go-to resource for any form of mental health other than something that we can prevent. So anybody who needs to talk to a counselor, anybody who needs some sort of psychology, psychiatric help, we turn to CAPS. We have a 24-hour hotline if CAPS isn't open, which would be like CAPS after hours. My internship is under CPO, Center for Prevention and Outreach, and we are all about a preventative approach to our mental health and overall health through our other subdivisions. I know Wendi was in here. She's also, I heard she was from SASE. We work with SASE. Whenever we don't know where to go, we go to SASE. They're our go-to person for when we don't know where to go. So we direct people there if they need it. And student health services, they are our overall physical side. They have the doctors, they have OBGYN. They can prescribe you medications, a whole bunch of wonderful things there. They're the first floor if you're on campus in Student Health Services building, and then CAPS is on the second floor. And then recreation and wellness is all of the fitness. Would you please advance? Thank you. Okay. And then we love to talk about our virtual Let's Talk, which is our brief free consultation with a counselor. It's different from CAPS because it's very informal, it's short, and it's kind of one of those baseline check-ins, see what you need to do. I kind of want to call it like the SASE of like psychological services in a way. So it's like, you don't know where to go, but you do know that you need some sort of help or somebody to talk to. So you're going to go to a Let's Talk, or you can go and check it out just if you need somebody to talk to. And our mental health peer educators, myself included, we are up to some very exciting things this semester. We've been working very, very hard and very diligently on creating workshops to bring to our students. And here is a menu of all of this slide and the next slide actually, are all of our workshops that our peer educators have created and have worked tirelessly on, and they're very excited to bring them to fruition. And a few of the upcoming ones are on the next slide. So Time to Plan is a workshop on planning. We have addressing anxiety. They're all peer, essentially like a peer perspective, because that's what we're trying to do. We're trying to connect peers to peers to have, like, bridge that gap in a sense where, you know, a professor or, you know, somebody in a sense above us wouldn't be able to do. So our job as peer educator is really just to, you know, be that open hand and provide some sort of a light in, you know, a world of darkness sometimes. But yeah, it's some wonderful stuff that we're doing, and I really hope to see some people or everybody at these workshops if they can make it.
Thank you, Gina.
Thank you. I also want to thank everybody who is here tonight. Everybody was really insightful, and I'm so grateful that I was able to make it tonight.
Thank you so much, Gina. And there are so many mental health resources on campus too. That kind of overlap, but that was kind of giving you just like a general sense of what we have, what's offered to Stony Brook, the Stony Brook Community Campus. So thank you again, Gina. We have such a wonderful group of mental health peer educators. I know there's a bunch of them in the Zoom room, I like to call it right now. So thank you all for being here and for staying tuned. All right, so we are going to finish off with a mindful moment to kind of bring us to the present with my wonderful supervisor, Danielle. So I'm going to pass it to you.
Thank you. Really quickly, I just wanted to add, Dina was saying that there is a lot of other supports. Student support team, not in those slides, is another really helpful support to know about. They're located in the Dean of Students, and this is like, they support students in all sorts of ways: housing insecurities, food insecurities, academic distress. They're really helpful in being bridges to where a student might need to go. So it's, you know, if you're uncertain, definitely student support team. And I just want to give a shout out to Chris and the LGBTQ+ Center. Always, whether it was now during this time or pre-COVID, there's always wonderful support spaces and happenings going on there. So it's a wonderful place as well to have a community to connect and to speak. And with that said, Dina, I want to thank you. This was definitely born from Dina and her passions, and I'm really grateful and thankful that you were able to put this together. It was really fantastic. It's been lovely working with you, and I just want to say I really appreciate that this is going on, because we've been talking a lot, like our peer educators and Dina and I, about how we're coming up on this year anniversary. So we're all hearing of this, but the fact is, in all of our individual experiences, we've had this collective experience that's gone on, which certainly includes trauma, grief, and mourning. And anytime, dates comes up, anniversaries come up, we tend to experience it in our body and mind. And unless we are talking about it and reprocessing it together, it makes it hard to heal and recover. And so this is a wonderful, I think, part of the reprocessing that is important and needs to go on. So it was really lovely to hear from everyone. And with that said, with the last minute that we have, I just wanted to have us join in a mindful moment. And so, at this point, if you could just kind of relax your eyes and take a few deep breaths to settle into your body and into the present moment. And as you're breathing deeply, just checking in with yourself right now, your body, your mind, taking this moment together. And as we bring this evening to a close, you could put your hand on your chest for a moment, and gently and quietly to yourself. You could repeat these in your mind. May I be safe. May I be peaceful. May I be kind to myself. May I accept myself as I am. Deep breaths together. May I be safe. May I be peaceful. May I be kind to myself. May I accept myself as I am. As we continue to move through this time together, please remind yourself to afford yourself grace and others grace. And please keep on reaching out and connecting. I want to bring your attention to this space. I'll give it back to Dina. Again, thank you very much, Dina.
Thank you so much, Danielle. That was such a nice note to end on. Thank you, everybody, for being here tonight. Like I said, we're super grateful for your participation. Warren, Jessica, Chris, Wendi, and Anthony, thank you so much for your input, your expertise, sharing your experience and your identities. It was a really wonderful conversation, and I'm so happy that we got to share that together. So I hope you all have a lovely weekend. I hope you get to take some time away from your screens and hopefully connect with one another. And yeah, have a wonderful rest of this semester. Thank you all so much.
Have a great weekend, everyone.
Have a good weekend.
Have a great weekend.